Have you ever waited for at least 1 hour for your number to be called at a hospital, but nobody attended to you? Hello and Assalamualaikum. My name is Syaffiya Iezaty binti Sulaiman, and today we are going to look closely at a current issue facing Malaysia's healthcare system, which is the shortage of medical staff, particularly doctors, nurses, and specialists. We are going to talk about the causes behind this shortage, its consequences, and then a focused set of solutions that have been proposed or already being put into motion. So, let's begin by understanding the current situation. I will give a short explanation of the articles above. So, first article by Amisha Shahira, it says that the Malaysian Medical Association (MMA) has reported frustrations among junior doctors over a lack of transparency in job placements within public hospitals. Many junior doctors who have completed training feel uncertain about how permanent placement decisions are made. So, next article by Ilya Marsha Iskandar. They said that on the nursing front, the Ministry of Health Malaysia (MOH) reports that in the past 5 years, about 1,754 nurses have left the public sector, and the country faces a shortage of roughly 43,000 nurses. And the last two articles talk about specialists and critical care areas. Associations says that there's a shortage around 10,000 specialists and 8,000 nurses. And last one is these personnel shortages are driving up workloads for those who remain, contributing to burnout. For example, one account described a day when a doctor had to deliver 10 babies before even having a brief break. In short, fewer staff gives off heavier workloads and greater strain. So, what are the factors driving this shortage? Let's see. For the first one is unclear career paths and contract systems. So, as we know, for junior doctors, there is unclear criteria for permanent positions. Relocation requirements and job insecurity undermine morale. For nurses, they have contract employment, high workloads, and low attractiveness of the professions all play a part. Next is high resignation. So, the high resignation numbers among nurses show retention is weak. Within a strong pipeline, it's hard to maintain numbers. For specialists, training is long and costly. If doctors don't see a clear path or a reward, fewer may pursue or remain. So the third one is burnout and heavy workload. As we know, in hospitals, the doctors and nurses have a heavy workload and work in a poor working condition. So staff shortages mean remaining personnel faced for long hours, high stress, higher risk for errors, and health problems, making the job less sustainable. So the last one is regional maldistribution. So for this one, as we know, there are some hospitals in rural areas or hospitals that face worse shortages due to being less desirable for posting, or that it is because specialized services are concentrated and overburdened in one place. Now that we've looked into the causes, let's take a deeper look at what these staffing shortages actually mean, not just for the healthcare workers, but for patients, hospitals, and the entire Malaysian healthcare system. So, the first and foremost, the most immediate implication is on the patient care quality. When hospitals don't have enough doctors or nurses, the workload on existing staff increases dramatically. One nurse or doctor may have to attend to far more patients than is safe or reasonable. As I said in the in the beginning of the video, this can lead to longer waiting times, delayed treatments, and even medical errors. For example, some doctors have reported delivering up to 10 babies in a single shift without a proper break, as I said earlier, which shows just how overstretched they are. When healthcare workers are forced to rush, the level of attention, communication, and compassion that patients receive inevitably declines. So, second, there's the issue about burnout and mental health. So, burnout is not simply being tired. It is a state of emotional, physical, and mental exhaustion caused by prolonged stress, and nurses and doctors work long hours under constant pressure, often experience anxiety, fatigue, and depression. Over time, this can lead to higher absenteeism and resignation, which worsen the shortage even further. It becomes a vicious cycle. Fewer staff mean more work for the remaining staff, which leads to even more burnout and resignation. The third one is the staffing shortage that affects workplace morale and teamwork. When hospitals are short-staffed, teamwork suffers and workers are less able to support one another. Communication breaks down and tension grows between management and employees. Many healthcare workers feel underappreciated and unheard, especially when they are not given clarity about placements and promotions. This creates a culture of frustrations rather than collaboration. And in healthcare, where teamwork can mean the difference between life and death, this is particularly dangerous. The fourth one is there's a broader impact on the national healthcare system. A weak healthcare workforce undermines the resilience of system. When there are too or few specialists, some hospitals cannot offer key services such as intensive care, emergency responses, and surgery at full capacity. This can cause patients backlogs and overcrowded at larger hospitals. In the long run, this reduces public confidence in government healthcare facilities, leading some patients to turn to private hospitals, which are more expensive and less accessible to lower-income families. So, the last one is the shortage of economic consequences. Replacing skilled healthcare professionals is costly. Training a doctor or nurse takes years and significant investment from both individuals and the government. When these workers leave, whether to other sectors or to overseas, Malaysia experiences a brain drain that reduces the return on that investment. So it also forces the Ministry of Health to spend more on overtime, locum staff, or temporary replacements, all of which strain the national budget. So, to sum up, the staffing shortage in Malaysia's medical field doesn't just affect those working in the hospitals. It also affects patients, the economy, and the nation's ability to deliver fair, and safe, and high-quality healthcare. It is not just a human resource issue, but it is a national well-being issue. So, after understanding the causes and the wide range of implications of staffing shortages, the next question we must ask is, how can we fix it? Fortunately, several initiatives and proposals are already in place in Malaysia that aim to address this crisis. These solutions can be grouped into three key areas, which is making nursing more attractive, improve remuneration and reduce workload, and lastly is retention and targeted staffing. So, the first one is nursing attractiveness. According to a letter published by the New Straits Times titled Ways to Make Nursing Attractive, experts suggested that several strategies to attract more Malaysians to the nursing profession. First, there is a need to improve working conditions. As we know, nurses often face long shifts, high patient loads, and emotional stress. Reducing this non-essential paperwork and ensuring reasonable nurse-to-patient ratios will help them to focus on patients' care rather than administrative burden. So, second is enhancing professional recognition is key. Nurses form a backbone of any healthcare system, yet their contributions often go unrecognized. Public campaigns, media portrayals that highlight nursing as a noble, skilled profession could inspire more young Malaysians to join the field. So the third one is the letter calls for clear career pathways, such as opportunities for advanced practice roles, specializations, and leadership positions. When nurses can see a future for themselves beyond entry-level work, they are far more likely to stay in the profession long-term. And lastly, offering the nurses flexible schedule and work-life balance would make nursing more compatible with family responsibilities, especially for women, who make up the majority of the workforce. In short, making nursing appealing requires not only better pay but also pride, respect, and empowerment. Next is improved remuneration and reduced workload. So, as we know, the private sector is also playing a role in addressing shortages through salary and workload reforms. So, in May 2024, IHH Healthcare Berhad announced that it was reviewing salary adjustments for nurses and exploring ways to reduce their workload. This included introducing patient care assistants to take over routine tasks such as transporting patients or handling paperwork so that nurses can focus on clinical duties. The group also looked into adopting digital systems to the streamline and reducing manual data entry and stress. So why is this important? Because compensation alone doesn't solve burnout. Job design does. So when healthcare organizations redesign roles to match employees' capabilities and provide adequate support, performance improvements and turnover decreases. So from an HR perspective, this is a perfect example of how human resource planning intersects with organizational design, aligning people, processes and technology to create a healthier workplace. So lastly is retention and targeted staffing. So another major focus is retention, keeping the professionals we already have. So in December 2024, in an article by News Straits Time reported that the MOH implemented retention policies at the Seri Manjung Hospital in Perak. So the hospital received additional staffing allocations to ease workload and prevent further resignation. So this case highlights a broader shift in the ministry's strategy, which is moving beyond recruitment to also focus on retaining existing staff through better support systems and fairer distributions of workers across hospitals. So these retention efforts includes offering a long-term contract or permanent positions to reduce uncertainty, providing housing and location allowance for those who are assigned to rural or remote hospitals, and also introducing mentorship programs to guide young medical officers and nurses in their early years. So these approaches align with the global practices that show employees stay longer when they feel stable, supported, and connected to their organization's purposes. So, as we can see, Malaysia is not ignoring this issue. The real steps are being taken to make healthcare work more rewarding, sustainable, and strategic. But to ensure lasting change, these solutions need consistent policy support and collaboration between public and private sectors, and a focus on people, the true heart of the healthcare. In conclusion, Malaysia's healthcare staffing shortage is not simply a number of games. It is a complex workforce challenge that spans recruitment, development, deployment, retention, job design, career development, and organizational culture. Without addressing all this, shortages will persist and the consequences will deepen. For those who are in HR or workforce planning, whether in the healthcare or other sectors, this case underscores how integral HR planning, talent pipeline, and job design are to organizational sustainability. For the Malaysian healthcare, the time to act is now. Thank you for your attention, and that's all from me. Bye bye.